And usually we talk about a hot topic in the healthcare industry in Asia. But about once a year or more, we sometimes just simply give a session on tips and pointers of conducting research in Asia. And that is what today's webinar will be about. So researchers who conduct studies in Asia quickly find out that things are very different from the West. But not only are things different from the West, there's a lot of differentiation within the Asian market itself. There's a lot of variation. No two countries are the same. No two cultures are the same. No two histories are the same. No two political environments are the same. So it's behoove of us to learn as much as we can about each individual market and how they are different. And today we will be looking at two very important markets in the Asian area, China and Japan. So today we will first of all introduce our participants, and then we'll jump into the meat of the webinar. And finally, we'll have a Q&A section at the end. You're more than welcome to ask questions at the end, or if you would like, you can simply input them into the chat box, and somebody in our team will address them as quickly as possible along the way. For your colleagues who are not able to attend today, you're certainly more than welcome to download a recording of this webinar on our website, and I'll give you information about that at the end of the webinar. For those of us joining the first time, I'd like to quickly just introduce our new office in Japan. Japan is becoming an increasingly important research area for Holden, and it becomes more and more necessary to ensure quality, feasibility at a reasonable cost in Japan. And with that in mind, we made the strategic decision last year to open up an office in Japan. So now we have an office in Japan, we have a team, and we have a panel of experts in Japan. And this office is led by our general manager of Japan, Koichi Ono, who is based in Tokyo. Joining us on this webinar are Maki Ogawa and Linda Lee, who are project and senior project managers respectively. And together, these two ladies have over 10 years of experience managing the healthcare-related research in the Japanese market. We're very honored to have them with Holden, and we're very delighted to have them with us today and sharing their insights about the Japanese market. Welcome, Maki and Linda.
Hi everyone, I'm Maki.
Hi everyone, my name is Linda. It's a pleasure to be here.
Thank you. And representing China, we have Eva Yang. Eva is the head of Operations and Resources Asia, as well as our Vice President of Research and Client Delivery in China. Eva has been in Holden for over 17 years and has a tremendous amount of experience conducting research all over Asia. Today, representing the Chinese market, it is my great pleasure to welcome Eva to this session.
Hi everyone, I'm Eva. It's a pleasure to be here today with all of you.
Yeah, thank you. Okay, without any further ado, I'd like to get into the meat of the conversation and jump into the first tip. The first tip deals basically with local healthcare resource structures and the patient journey in each country. This will include where patients go and what facilities are available, and the processes and platforms that are involved in the treatment choice. One area that both China and Japan are quite different from the West is the availability of PCPs. So I've heard compared how do patients get treated without the presence of a PCP. Eva, can you start us off?
Yeah, sure. Actually, there are no primary care units in Chinese medical system. So in China, people usually go directly to any type of hospital or any type of specialist they would like to see. They do not need the referral letter from, primary care doctors. So for example, when a person feels not good with his stomach, he usually goes to see the gastro directly. Or when the people feels pain in his heart, he will just go to see the cardiologist directly.
Yeah, it's very interesting, very different from the West. But how does a patient know what specialist he needs to go to? So, for example, if he has heart pain, the cardiologist might be the best person to go to. But heart or pain in the chest could be symptomatic of some other condition that requires a different specialist. How does the Chinese system ensure that people are choosing the right specialist?
Yeah, that's a good question. So actually, this does happen quite often. In fact, every Chinese hospital has a pre-examination counter. So trained staff there. They are providing the quick assessment and will direct people to the right department or the right specialist. So this is very important, especially for the first-time visitors if they are not sure where to go.
Interesting. How about Japan? Are PCPs common in Japan?
Well, we don't call the doctors PCP or GP, but usually our neighbor internal medicine play a similar role to GPs and PCPs in the UK and the US. Actually, healthcare system in Japan is quite similar to China, but unlike China, we go to the neighbor clinic first, as per the symptoms we have. For example, when we have symptoms of hay fever in spring, we go visit an allergy or ENT clinic. And when we have pain in our knee, we just go visit an orthopedic surgeon directly. But hospitals are for advanced checkups or treatment after our neighbor doctors issue a referral letter.
Interesting. Okay, jumping on to the second tip, and kind of similar to the first tip. The first tip we were dealing with PCPs, and the second tip I'd like to talk about nurse practitioners and physician assistants. I know that we often get requests for research where we need to target nurse practitioners or physician assistants and find out that these positions aren't even available in many markets in Asia, especially in China and Japan. So just jumping into our experts now, starting with Eva, why are physician assistants and nurse practitioners not available in China? I'm sorry.
Sorry.
Yeah, go ahead, please.
Yeah, in China, the basic reason is the basic reason for lack of an MP or PA is simply because the different medical system. So the medical system is quite different in China compared to Western countries. In Chinese medical title system, we don't have the education or certification for NP, PA. So in our system, there are only 4 types of professional titles have the right to issue prescriptions for patients. So like you just see on the screen, these 4 titles.
Interesting. How about Japan? Can we find nurse practitioners and physician assistants in Japan?
Right, so similar to China, Japan's medical system can be very unique too. While NP is still not common in Japan, recently there is actually a movement to consider expanding the role of nurses. And the introduction of a certification system like NPs is also under discussion. Unlike nurses, it is not a national certification recognized by the government, but it is a qualification that's provided by a private organization. It is something like a master's degree. So it seems currently there are actually 900-ish MP in Japan, but we need some more before we can really conduct surveys with them. PA, on the other hand, is a profession that does not exist yet in Japan. So for now, we have to say it is very hard to find a mid-level HCP between physicians and nurses in Japan, and we do feel the needs. So I think things might change very soon.
Very interesting, and it's definitely a key difference with the West. So I think a lot of participants in today's webinar will be very interested in this. Jumping into the third tip, and that topic is
Sorry, Jeff. I think we got some questions for China. Yeah.
Let's see. So a question is, in rural areas in China, don't have PCPs or healthcare professionals who are not physicians. Okay, that's clarification. So in China, are chief physicians considered KOLs?
Yeah, so for the first question, yeah, even in rural areas in China, we don't have PCPs. So we have the internal medicine physicians who work in like community hospital or the town healthcare service center, who act like the PCP role in Western countries, but they are still professional, certificated usually internal medicine physicians. And for the second question, yeah, chief physicians is usually the people we will target if we are looking for some KOLs, because those person usually have the very high power or influence in the industry. But sometimes some vice chief physicians, they also have very high power or influence, or have reported a lot of research reports. They can also be considered as KOLs. So usually we decided by how many reports they've been published, how many speech they've been gave in the nationwide or even global seminars, conference. So vice chief also have the possibility, but chief physician is the mostly key people for KOLs.
Thank you, Eva. Okay, I'd like to jump into the third tip, and it's a topic that's been gaining a lot of traction, especially post-pandemic, and that is vaccinations. I'd like our participants to talk a little bit of the vaccination process. How do patients receive it, and what is available? What is the journey in getting a vaccine? Can we start with Japan?
Sure, thank you, Jeff. In Japan, people can go visit private clinics or hospitals that's designated by the local government. So the process is like, first, we just need to check which clinics or hospitals can support the type of vaccine we're looking for. This information can all be found on the city district government homepage. And then after we decide, we book a time. When booking, by making a call or directly or using like reservation app, the clinic or the hospital will let us know if the vaccine is available right now or not. Sometimes there's no stock, so we have to wait. And then the vaccine will be basically conducted by a physician, who should know well about the person's medical history. We also need to fill out a form on the day stating our current health situation. So there is a possibility that the physician decide it is not a good day to get the injection because like we have a little, like our fever is a little bit high, something like that.
Thank you, Linda. You mentioned that the vaccine should be administered by a physician who knows the patient well. I suppose you're talking about the regular doctor. What if that regular doctor is not available?
So I would say most people prefer to visit a doctor who know them well. So our records, so like I mentioned earlier, we visit the neighbor clinics first. So they're quite nearby, and our records in those clinics can be accessed by all the doctors who work in there. So you see, we have to make a reservation before we get the shot. So it means there will always be a doctor who is prepared and wait for us there.
Okay, thank you. That clarifies it. I see there's a question about patient recruitment. We actually have a whole section just a little bit later in this webinar about patient recruitment. So please hold on. We'll get through the vaccination tip, and then we'll be on to probably a little bit more detail about patient recruitment. So back to the vaccination area. Having lived in China myself, I know that getting a vaccine in China is a pretty simple process. Eva, would you agree?
Yes, China well. Yeah, indeed in China it's very simple and convenient to get a vaccine. So normally we just walk into the vaccine sites. Sometimes people will make an appointment beforehand, just want to save some time, because if you make an appointment, you will be treated priorly. But usually people don't do that. Making appointments is also very, very easy. It can be done through apps and WeChat. And sometimes we call the sites to make appointment too.
Yeah, it sounds very convenient, but how can you always get the vaccine you need, considering people walk in without an appointment?
Yeah, sometimes not. It's really hard to guarantee that, especially for those with limited stock or high demand vaccines. But so sometimes people can call the sites to confirm the availability to make sure it is being you can find there. Or sometimes they make an appointment. That will be 100% sure. But for most regular vaccines, that isn't an issue. You just walk in and we can get it.
Oh, interesting. And Eva, what healthcare workers are involved in the vaccination process in China? I know that we get a lot of requests for doctors, but we find out that doctors aren't the appropriate role for vaccine administration in China. Who does it, and to what extent are doctors involved in the vaccination process?
Yeah, in fact, in China, doctors are playing a very limited role in vaccination. The key participant is only nurse. So because vaccination does not require a prescription from doctor in China. So people just walk in, and the nurses are the main person who do the administration. So yeah, that's it.
Interesting. And I heard that vaccines are optional in Japan. Is this right, Linda?
Actually, it's similar to other countries. There are two broad categories of vaccines in Japan, regular and optional. Influenza, the COVID-19 vaccine, they are optional still. However, some vaccines that are optional in other countries have become regular in Japan. For example, HPV, shingles, and rotavirus, which all I know just become regular very in the recent years. What is also different in Japan is so for those optional vaccines, people have to pay by themselves. They're not covered by insurance.
Oh, very interesting. Okay, great. I see there's another question about payers, finding payer and doing payer research in China and Japan. Actually, one of our topics, one of our tips later on in this discussion will be about payer research as well. So please hold on a little bit and we'll get to that one. For the next tip, I'd like to talk a little bit about patient recruitment. This is something that came up in the questions earlier in the webinar. I know that targeting patients can be quite a challenge in Asia due to cultural differences and, of course, sensitivities depending on the condition. I'd like to ask the participants in the webinar today to how recruitment is done in your markets, specifically China and Japan. So why don't we start with Eva? Eva, can you tell us how patients are recruited in China?
Yeah, sure. So, for China, the first step is usually our in-house patient panel. We have our dedicated patient panel, so we can recruit from the panel directly. But if we cannot find enough candidates, for example, sometimes the rare patients, so we will ask our patients or the doctors to do the referral for us. We also have a very large panel of doctors.
So you can use your HCP panel to have the HCPs introduce patients. Is that right?
Yeah, that's right. That's a very standard process for us now. Even for quant, we do not do that for only for qual, we do for quant as well. For quant, we can leverage our HCP panel to have them to referral patients too.
Interesting. How about Japan? How are patients recruited in Japan?
So in Japan, unlike China, unfortunately, we don't have our in-house patient panel for Japan. And actually, it is really kind of hard to gather a number of patients in Japan for like maybe cultural reason, and also everyone cares about their privacy. And so I'm not sure how many years we need to establish the patient panel for ourselves. But for common diseases, we work with our partners who have consumer panels. By common disease or symptoms, I mean conditions like diabetes, hypertension, hay fever, and menopause. But when it comes to uncommon or rare diseases, we usually approach the patient association, or maybe someone say a patient advocacy group. However, we need to keep in mind that some organizations still may decline to participate in the study.
Similar, Maki, that's very interesting, Maki. Can we use HCPs to refer us to patients in Japan?
Well, patients' referrals are not common in Japan. We usually reach out to the patient association before approaching a certain patient. But in projects that involve interviews with both doctors and patients can be referred by the doctors sometimes. But due to concerns about privacy and maintaining the trust between doctors and patients, only a few doctors are willing to make such referrals.
I see. So it's a little bit difficult there. We have a question related to the patient panel and how frequently is updated. Since we don't have a current patient panel in Japan, I assume this question is directed to China. Eva, how frequently do we update the patient panel in China?
Normally, we update it once half a year. But it also depends on the projects. So if they have a project, we will also update the panel according to the information we collect from the project. So that's unregularly. Regularly, there's once half a year.
Okay, very interesting. Okay, and Mike, and I have a question about patient research and to what extent caregivers or family members can be used in patient research in your markets. Starting with Maki in Japan, can we use family members or caregivers? Is that a possible option in Japan?
Yeah, as for family members or caregivers, we usually find them through patient associations, especially for the study of rare disease for children.
Okay, and how about in China? Can we use family members or caregivers? Can we target those type of people for patient research as well?
Sure. And actually, we recommend clients to involve the caregivers in patient research in China, especially for the patients with, for example, elder patients or the patients who cannot take care of themselves or the patients who did not get much education. Because in China, these patients usually are being accompanied by their family members when they visit hospitals. Sometimes the family members are the main communicators with the doctors. So as a result, family members often know more about the patient's condition and treatment and know all the things compared to the patient themselves. In some cases, even the family members are the people who make decision for the treatment.
Very true. Very interesting. Okay, I have another question too. I know that historically there used to be a lot of face-to-face recruitment of patients, probably a lot less now. I'm wondering, is this still a possible way to recruit patients? For example, face-to-face recruitment in hospitals, is this possible? I imagine this would be very difficult in Japan. What do you think, Maki?
Yeah, face-to-face recruitment is something we don't do that. Yeah, if we like walk into the hospital and then maybe try to talk to doctors or patients, maybe the hospital will refuse us. And even for the recruitment for doctors in like by face-to-face, we don't do that. And so we usually, but alternatively, we send a physical letter to the doctors instead of email because they receive a bunch of emails every single day. So physical letter is something remote like that we can get attention from them. So, but usually we don't send a physical letter to patients. So our recruitment method is mainly like online or patient association still.
Yeah, that's very interesting. You use that old way, sending letters to doctors sometimes to get their attention. That's very interesting. And thank you very much for sharing that, Maki. What about in China? Is the old traditional face-to-face recruitments possible in China still, or is that something we can't do any longer? Eva?
Not really, actually. It was very common before COVID. It's like one of the traditional way to recruit patients.
Mhm.
But after COVID, everything changed. All the methodology changed to online. And especially because the management of hospital is being more and more strict, so the visiting to the hospital and is much difficult than before. Not to talk recruit patients in the hospital. So we don't really use that way in nowadays.
Interesting. Yeah, so not so much in the traditional way. What about more modern ways? I know that social platforms have had a very transformative impact on research, and I imagine there's been an impact on recruitment and perhaps even moderation of research work in Japan and China with patient research. So, to what extent can we use social platforms for conducting patient research in Japan?
Yeah, we sometimes do the online recruitment, social media recruitment in Japan. And some people share their experience of personal illness, fight journeys on social media like YouTube, Instagram, and blogs. But X, the former Twitter, is still our strongest platform. So when we want to collect the personal opinions or experience, sometimes the X search function work much better than Google. It's interesting.
Okay. Yeah. How about China? I know that WeChat as a social platform is very big in China. What other platforms might be used in China?
Yeah, we found more and more Chinese patients start to sharing their experience on some social media platforms, such as TikTok and the Red Note. I'm not sure if you heard that. So we also have started trying to approach them through those social platforms. And the good news is we have achieved some good result by this approach, especially for the patients with non-common diseases. It's really a good approach to find them.
Okay, interesting. Yeah, we have a question. It's looks I'll go ahead and read it out. It's a question on cities in China. It says we always used to focus more on tier one cities, Shanghai, Beijing, Guangzhou. How common is it to extend studies to tier two cities or even tier three cities in China?
Yeah, it's quite common actually. I think in the past 5 years, it's changed. More and more clients, start to focus on the lower tier cities. Uh, Most of our projects is targeting tier one and tier two cities. And for some part of our projects, the client wants to understand the lower city, like tier three, even tier four cities, market information.
So those are still those are definitely possible to get into more lower tier cities in research work in China, right?
Yeah, sure.
Okay,
Yeah.
good. All right, there was a question about effectiveness of it's no longer on there. It was about the effectiveness of face-to-face recruitment. I'm sorry, I don't remember the full question. It's been deleted, but if you still have it, please put it in there and I'll ask the team. Or perhaps we've already answered it in the course of the webinar, and that's okay too. Okay, jumping on to the fifth tip. We'd like to focus on payer research. You get a lot of questions, with a lot of requests for payer research in both Japan and China and all of Asia for that matter. And sometimes we are really successful of doing payer research, and sometimes we struggle a little bit depending upon the market. So I'd like to talk a little bit about payer research, whether it's possible or not in your markets, and if it's not, what is an option that we can consider. So starting with Japan, I know that actually recruiting and talking with payers is next to impossible in Japan. Can you help explain this, Maki?
Sure. So in Japan, as someone mentioned earlier, the current payers cannot participate in the market research. So the payers are government officials or someone who work within government agencies. And generally, they are not allowed to engage outside activities like market research due to their employment rules. Well, the role of payers in Japan is different from what many of our clients expect. So actually in Japan, the government is the responsible for all major decisions related to healthcare, including setting the price list for the treatment and drugs. So usually payers in Japan review the documents that are submitted by patients and make reimbursement based on the government defined rules, the patient's income level, and the health insurance plan that they are enrolled.
Okay, so getting payers is very difficult or almost impossible in Japan. What do you do if a client overseas needs to find somebody needs to talk to a payer or somebody who can speak to the payer system in Japan? What do you recommend, Maki?
Yeah, so we understand that global pharmaceutical companies wants to know how pricing decisions are made in Japan. So to gain insights into this process, we recommend approaching the former government officials or relevant advisors or KOLs. But just please note that these individuals are not experts in specific disease or treatments, as we often get requested.
Right. But they could speak to the actual payer process, right? I think that's probably the best solution in Japan, given the fact that it is a one payer system and all the rules related to decision makers. How about China? Is it possible to recruit payers in China?
Yeah, in China, we can interview current payers. So, for payers, we usually mean the officers who work in the government organizations which are involved in some medical policies, such as we can see here, like the NHC, NHSA, or NPMA. So, but officers who work in the different organizations, or they work in different departments or different roles, they usually have quite different knowledge or have been involved in quite different processes. So for each research, we usually recommend client to share with us the research purpose better in advance so we can help them to identify the correct target. So which officers, which role is the correct target for this research, especially.
I see. And are these payer experts, are they regional or are they national or both?
Yes, you can see on the screen, actually, we have three layers of payers in China: the national payer, provincial payer, and the city payer. So they're in quite similar organization, but just in different layer, in different region. So for market research purpose, we usually suggest the client to combine, national payers and the regional payers in one research, so you can understand the national situation. Also, you can understand how the city or the province make those policies on land.
Very interesting. And we have a question. We have a couple of questions, but one I'll take the one that's related to the pair research due to the pertinence right now. I'll take that one first. And the question is, are there hospital pairs in China? Hospital pairs in China. These would be individuals who decide what drug is covered in the hospital, I suppose is the question.
Yeah, we do have that. Because sometimes we call it hospital payers. So, it's usually the president of the hospital or the vice president of the hospital, and sometimes the director of the pharmacy. They act as the role to decide what drug is being covered by the hospital.
Okay. Thank you for clarifying that, Eva. Another question that has been asked is actually close is actually a follow-up to the question that was asked before, I think. And the question is there a list of tiers in China that Holden has published? What's in tier 1, for example? What's in tier 2? What's in tier 3? Do we have a list of like that we can share with?
Yeah, sure. Yeah,
okay.
we can share that after the webinar.
Great. So if you have that request, please let us know, and we'll share it with you. And then clarification in a question that was asked earlier. Let's see, sorry.
The methodology?
Yeah, about the effectiveness of recruitment. The earlier question was less about recruitment and more about research in-person interviews versus tele-depth interviews. I'm sorry, I'm not quite sure about that question. If you could rephrase it in a different way so I could understand what the actual question is, it'd be very helpful. And then another question is, are these experts, I suppose we're referring to payers, comfortable doing recorded interviews, especially in-depth interviews? Eva, can you ask for China?
Yeah, of course, not all of them, but there are a lot of experts. So the ones we reached, if they feel comfortable, then we recruit them for the interview. If they do not feel comfortable, they will reject that. So if the people we can successfully recruit them, they are okay to do that.
Okay. Great. How about in Japan? Is it okay to record? Or are they comfortable being recorded? The KOLs.
Yeah, it's just like China, but whenever we do the interviews with experts, we always ask them to fill out the form, like consent form, that like we're gonna record this interview for the internet use or something like that. And then usually the people agree with it, but sometimes they agree with the recording of the recording, but some people refuse to do the VCLs.
I see. Okay. I hope that answers the question. And then the follow-up that was not clear before it's been asked again. Is it more effective to conduct research in person or online via phone?
Yeah, definitely online nowadays, especially after the COVID. I think most of the physicians get used to online interviews and they prefer to do online interviews as well. And saved a lot of travel cost and time to do, especially, China is very large. If we do a interview to some cities far away, we need to take long time on the way to there. So online saves the time.
Yeah, that makes a lot of sense. And I know that in Japan, prior to the pandemic, it was very difficult to do a lot of online interviews. It was always preferred to do face-to-face. And since the pandemic, it's kind of switched completely, becoming a lot more common to do online interviews or telephone interviews rather than face-to-face interviews since the pandemic. Would you agree with this, Maki and Linda?
Yeah, I think so. Well, for some reason, Japanese people still like to use some physical thing. We still use cash a lot as well. So, but some people might know, like Japanese people work too hard and die, and it's called karoshi, and so now anything we can save our time or like cost or whatever, like efforts, we prefer that to do that. So online or telephone interview is much preferred.
Okay, it's interesting how that's transformed. Another question. I understand that online interviews are very convenient, but what about personal relationships we build by visiting doctors in their clinics and hospitals? So
Yeah,
I
so
guess
for
I guess the question is as we're moving more and more into online platforms, it's becoming more technological based. There the assumption there is that it might weaken our ability to actually develop the relationship with the doctors the same way we once were. Could somebody speak to that in China or Japan?
Yeah, so for China, actually the doctors they prefer online relationship now. They don't want people to visit their office face to face. So that's why we can build large panel in China because doctors like to join the online activities.
Hmm.
I
Yeah,
guess it's
totally
quite
same
similar
in
in
Japan.
Japan.
The same in Japan. Yeah.
Yeah.
Yeah,
Yeah. So
some people might feel the like in-person meeting is kind of waste of time for some doctors. Yeah, sorry for like the honest speech, but yeah.
yeah. It's interesting how the market has changed. I mean, there was a time, especially in Japan, when it had to be all done face to face. So, yeah, to answer the question, yeah, the market is changing, and the doctors have changed with the market, and their preferences have changed too. So, a lot of times, the only choice we have is to do online interviews, and setting up the relationship will have to be done in other ways when they're brought into the panel to begin with, and um, perhaps catching up with them through non-interview ways when we update the panels and whatnot. Another question, are online virtual focus groups possible or recommended in Japan and China? So virtual focus groups, I suppose, is the key word here. Are they possible in China or Japan? And let's go with HC. Let's talk about HCPs and patients as well. Let's keep both of them in mind.
Uh, yeah, actually, I think this is quite similar and no with our next topic, but we can ask this first now. So virtual focus group is feasible in China, but we can only do mini group like trials. But more than 3 people, it makes much more difficult. And online bulletin boards, right? Yeah, we do a lot of online bulletin boards projects for doctors in China and also for patients.
How about Japan?
Yeah, so the virtual focus group for doctors, ACPs, are quite difficult in Japan because culturally in Japan, um, like experienced doctor is more superior than the young doctors. So once we gather like the doctors with different ages, younger doctors stop speaking, and then probably the like experienced doctor keeps talking. But regarding the patient's focus group, Eva might have like more experience. What about have you had any experience about the patient group in Japan?
I think that's very difficult too. The same as the physician ones.
Okay.
Yeah.
Yeah, so very clearly, I mean, this type of group interviews, focus groups are still quite difficult in Japan, and also difficult in the online platform as well. There's a question specific to HCPs and KOLs interested to spend 90 minutes in a focus group. I think in Japan, the answer to that would be, whether they're HCPs or KOLs, it's not going to be probably possible to do focus groups in Japan. It's just it kind of goes against the grain of the culture, but also it's very difficult to carry out. Very difficult to find doctors who are willing to do it. So we don't really often offer this in Japan. What about in China? Focus groups, 90-minute focus groups in China, is this something possible?
Yeah, it's possible. I can't say interested, but they can do it. No, is we pay, especially when we pay the relevant incentive. And actually, sometimes some HCP they really enjoying because they like to talk to, they have the opportunity to talk to other physicians. But that's just some doctors. But it is possible. It's quite possible. For 2 hours focus group. I mean mini groups.
Okay. And writing on this topic of focus groups and different technologies and platforms that we use, it dovetails very nicely in with our last tip, where we talk about innovation technologies and platforms. So research is changing so much with the new innovations platforms, AI. We see a lot of stuff coming out there, different ways to recruit, different ways to host interviews. And I know that there's some really new exciting ones. I'd like you guys to share a little bit more about what is exciting on your market. Maybe we could start with something like the platforms of Recollective and Remesh, some new platforms. Are they possible in China and Japan? Let's start with you, Eva, in China.
Yeah, we also found from especially from the recent year, we've been asked a lot by clients for those kind of new technologies, tools such as the Remesh, Recollective, and sometimes we've been asked about AI moderation as well.
I see. How about in Japan?
Indeed, more and more clients are keen to try new technology in Japan.
And what about Remesh specifically, Linda, in Japan? Is it a possible platform that we can use in Japan?
Yes, actually, we already conducted a remesh project. I think not just once, with physicians successfully. I'll just provide an example. At that time, we recruited 70 physicians, and then we provided them the user IDs to log into the remesh system. At that time, it was a live session, so all people should log in at the same time and participate in this 60 minutes discussion. It's a little bit like a focus group, but there's no audios. I think that's why we can still do that in Japan. Then in that platform, both close-ended and open-ended questions are available. For the open-ended questions, sometimes the participants can allowed to check each other's answers, so then they can discuss based on them. And sometimes they're not allowed to see others' answers, so client can use that function wisely. Another point worth mentioning is Remesh. It actually provides solution to simultaneous translation and even moderation. As you can imagine, it is not easy for so many people to appear at the same time. As a result, out of the 70 positions we recruited beforehand, 55 of them completed the session successfully. I have to say it is already exceeded our expectations very strongly.
That's really good. I mean, that's exciting that Remesh has been so successful in Japan. How about in China? Can we utilize this platform in China?
Actually, in China, we didn't use Remesh, but we have done similar methodologies with some other platforms. But I heard this is quite interesting methodology and really a good try in Japan. So we are very interested in Remesh and eager to try it in China as well.
Okay, and we have a question now. Is it compatible with smartphones or does it have to be used on a laptop? I guess that's for mesh.
Yeah. I think laptop is preferred and smartphone because sometimes it needs more function, like you have to vote or share some comments and do some functions. So smartphones may be limited.
Okay. What about Recollective? That's something that's been asked recently a lot, that type of platform. What is the possibility of using Recollective in China?
Yeah, Recollective is more like it actually is being used like in online bulletin board platform that I some kind just asked. It's being mostly used for online short-term community or online diary projects. So it's quite similar to Rematch that people have to log into the platform with some user ID and they have to answer close-end or open-end questions as the engagement. And sometimes they can discuss with other doctors, sometimes not. And a moderator can probe on the questions, on the answers from each doctor or each participant. But the big difference between Recollective and Rematch is Recollective is not a live discussion. So it's usually open for a few days or a few weeks. So respondents can log in at their convenient time.
Oh, very interesting. How about in Japan? Can we use Recollective in Japan?
Yes, we also call it a flexible session. The recruiting process is quite similar to Remesh. For now, we hope to get those two platforms to be used more efficiently and conveniently.
Okay, interesting. Okay, is there anything else we need to know regarding online interviewing platforms in Japan?
Right. So for Japan, what I want to say is while it's such a highly developed country with such top medical technology, it is surprisingly very traditional and stable in many ways. While new technology is very exciting indeed, we feel that for interviews, Zoom is still the most popular and easiest tool. And then also Microsoft Teams is also a nice option. So for those high-tech platforms, we might want to recruit to assure we get enough participants.
Okay, so basically that we able to do a lot of new technology, but still the best is the tried and true Zoom and Teams to
Right.
ensure that.
That's right.
How about in China? Would you say the same, Eva?
In China, the most widely used platform is actually a local platform called Tencent Meeting. It's being developed by the local company. It's being most preferred by doctors as well. But we also can use Tencent. Teams and Zoom is also possible in China as well. And recently, we have been asked about some new platforms such as Discuss.io, Cobalt. However, we had experience with Cobalt, but I have to say the experience is very bad. So we do not recommend Cobalt as the interview platform in China. For Discuss.io, we haven't used it, but we have been go through the whole platform. It looks good, but we still need a real case to confirm.
Oh, interesting. So definitely possible.
Yes.
Okay. A question, can we integrate Remesh panel or we have to manually feed each respondent's details?
According to the experience we have to manually feed. So it's separated platform.
I see. Okay. Discuss.io is very bandwidth intensive and can be very unstable unless respondents have the highest level bandwidth.
Thanks for
So
sharing.
that's good to know. To be honest, I don't think we've done a lot with Discuss.io. We've done a lot of testing on it, but it's good to know about this requirement of high level bandwidth. That's good to keep in mind. Thank you for sharing, Ray. Okay, that finishes our sixth and final tip. I'd like to kind of open it up now for any lingering questions that anybody might have. If you have some questions, please either shout them out or you can certainly put them into the chat box like we've been doing all along. Any other questions? Okay, we're kind of running out of time anyways, and I want to make sure that everyone get to their next meeting. AI moderation. Does anybody have any comment about AI moderation?
Yeah, we've been asked. Yeah, so that's being used, you normally we have a moderator, which is a real person, talk to the respondent one-on-one. But the AI moderation is the respondent just log in the platform, and there will be moderator created by the AI technology, and the people, actually it's not people, the AI will talk to the respondent, will have react or probe questions, follow the respondent's answer.
Okay, great. And a lot more to come with AI stuff in the future, I'm sure. Right.
Yeah, I'm sure.
Okay, thank you everybody for your questions. As a last part, I would I'd like to introduce a little bit of news about Holden, something to share with you. For those who have been on the webinar before, you've heard me talk about our eQuote system before. I just want to say a little blurb about it now. Again, eQuote is a platform that we set up that would give you instantaneous feedback on feasibility and costs for a project you're running in any of the Asian markets. You do not need to reach out to anybody specifically. You can just simply get onto our website, access the eQuote platform, type in your criteria for your project, and you'll get instantaneously feedback on the price and feasibility. So it's the perfect platform if you are in a rush and you need to get a ballpark idea right away, or if you just simply want to play around and get an understanding what's possible in the Asian market. You're certainly more than welcome to use it. It's open to any of you, and we encourage you to use it. To get on it, just simply need to get onto our website and access the eQuote page. Finding costs and feasibility in the Asian market has never been easier. And in closing, I would like to thank everybody who participated today. Thank you so much to our panelists, Linda, Maki, and Eva. You've done a wonderful job, and I thank you for all your preparation. It was a very interesting discussion today. And I'd like to thank all the listeners for jumping in and being interested in the Asian market. It's very exciting, and very, very happy to share relevant information on the Asian market to you. We look forward to you joining our next webinar. Thank you, everybody.
Thank you, everybody.
Thank you. Thank you.
Thank
Bye-bye.
you. Bye-bye.
Thank you.